Hello, hello. Melsa, the acupuncturist here. Um, welcome. These are I'm sending these to my subscribers. I used to do these when I had a Facebook group a while ago, and it's just kind of like musings because I see about 40 to 50 women per week, going through IVF and fertility treatments and IUIs and all that stuff, and just want to chat about stuff that I talk to my patients about. So I hope this helps. I hope you enjoy this. Hit the like on the, what do you do? Like and subscribe. Anyway, so none of this is medical advice, but just wanted to share a couple of things that I heard this week. So, first of all, in December, I just did my tally. I had 8 transfers in December, and I had 6 positive betas, which was really awesome. The 2 negatives are really heartbreaking because they were both PGT tested embryos. So, you just kind of don't know why that happens, but unfortunately it does. But we're so happy for the 6 that are trudging through their first trimester and, first, second betas and waiting for ultrasounds and all of that stuff. So we're super happy for them. But this is my first week back in clinic in the new year. I wanted to talk a little bit about digestion because I talk about digestion a lot. I had this conversation with probably. Mm, but one yesterday, and then a couple of weeks ago, just everybody was coming in with kind of wonky bowel movements. And so we talk about poop and periods all day long in this clinic. And so, if you are having like IBS or constipation issues or like diarrhea, if your bowel movements are not like nice once a day, formed, easy to pass, once to twice a day, or if you're having problem digestion, so like IBS or constipation, diarrhea, you're probably sensitive to something that you're eating. Typically, it's gluten, dairy, or eggs. Those are kind of the top 3 offenders. It can be other things. You can do a food sensitivity test. One of my new patient yesterday that I was talking to, that having this conversation was like, well, I've been to the GI doc and they want to do a colonoscopy and an endoscopy. But I was like, like just get off gluten and dairy for 2 weeks and tell me how you feel. Basically, she isn't pooping, and then all of a sudden it would be diarrhea. So if that's you, give up gluten and dairy for, at least 2 weeks and see how you feel. I promise you're going to start pooping. And the thing is that in Chinese medicine, our fertility and our digestion are intimately connected. And so I kind of always say, fix the digestion, fix the period, and get pregnant. And especially because basically, that like what that is telling me is that you've got some inflammation in the body. And what does inflammation do? It harms, egg quality, sperm quality. And so, we really just want textbook digestion, and just clean it up. Just don't eat refined carbs. Definitely avoid gluten, avoid dairy. If you know that you have some sort of trigger, don't eat it, especially while you're doing fertility stuff. So, I just advocate for really like super, super cleaning up the diet, and just avoiding carbs as much as possible. I only had 1 transfer this week. It's kind of, it's new. It's right in the new year. And my favorite fertility clinic that I've worked with super closely with for 10 years, their lab was closed over the holidays. And so everybody's kind of gearing up. I've got several patients who are starting to do injections for retrievals, but I only had 1 transfer this week. And bless her, she came in today. Her transfer was yesterday. And they called her yesterday afternoon and told her that her progesterone was really low, and she just lost her mind. She just and I mean, this happens all the time. I just kind of want to say that. I had patients this week, or the patients who transferred last month. One progesterone was at a 9. I think one was at a 5. And so then the clinic usually just doubles the dose. From 1 ml of progesterone and oil, to 1.5 or 2, depending on how low it is. Hers was at a 19. They just wanted at a 20. And so I was like, oh girl, I mean, she basically went worst case scenario. Last night it was just like, nope, it's not working. It's not working, which of course our brains do because we have anxiety brain when going through fertility stuff. But, it happens, like, progesterone, sometimes it just isn't, it's just, for some reason, not being absorbed. Sometimes you take your labs, before you've done your PIO shot in the morning, so, or in the evening, and so it can be a little low, but, just know, it happens all the time. What else did I have today, for you guys? I don't know. Um, I was just, this is, we're doing, like, a few minutes here and there. I used to do these on Saturdays, and I really just kind of like wrapping up the week, with stuff that I've heard in clinic. Just the things that my patients are thinking and going through, and it's just, if this resonates with you, give me a little like. If you have any questions that you, want me to answer on anything. I get questions all the time, like, "Can I do hit workouts?" No. Like, "Can I take cold plunges?" We don't love it. But anything like that, anything that you, have questions, that you guys have questions on, I'll answer it. I think I'm gonna try and do these every Saturday just after closing up clinic. This is my one of my treatment rooms. I saw patients this morning, and, yeah, I'm just gonna start doing these. So, hopefully you're doing acupuncture if you're doing your fertility, if you're doing fertility stuff. If you're not doing acupuncture, I have my acupressure classes. I have my IVF Acupressure Academy, which is, I'll put a link in the description below, but you've probably gotten emails from me if you're getting this. But yeah, I have my IVF Acupressure Academy. And then I also, if you don't want to do that, the whole shebang with, like, the pre and the post and the mens and the, all of the things, I have just my five favorite, acupressure points. And it's a little cheaper. It's like less than $50. So you can do that, daily as well. Because if you're not doing acupuncture, I would definitely, incorporate acupressure into your routine. So anyway, I hope you guys are having a lovely Saturday. And yeah, I'll see you next week.